Good morning. We start our working day. The topic of our first briefing is presentation of online platform of the project Drugs Control aimed at checking medicines procured on the account of budget money. Our presenters today: Oleksandra Ustinova, Director of Medicine Section, Center for Combating Corruption; Olena Scherban, Lawyer, Center for Combating Corruption; Olena Kolesnik, Director of the National Cancer Institute; and Iryna Lytovchenko. We had a news briefing already, and we were talking that according to the first results of our project, about 40% of money are saved on oncology patient drugs, and the journalists asked us what next. The more medicines will be bought, the more medicines will be resold, or they will be just stolen by doctors. Our organization for 3 years have been monitoring the procurement of drugs against tuberculosis, cancer, hepatitis, and it was HIV, and it was strange for us for many years why the government pays billions, but no patients receive any medicines. Even bandages are bought by patients for their own money. When my father was diagnosed cancer, the doctor sold us drugs through deceitful practice. We were in the situation when we needed medicines fast, and the doctor told that he has drugs for chemical therapy. And then I checked as an MP, and we found that those drugs were bought for budget money, and I'm sure these cases are not rare, so we understand that very often doctors form such requests for medicines which they can resell. So we start with oncology, and we hope that further new programs will be launched to check all other drugs and all other spheres of treatment. You can see on our web page the drugs for oncology patients which are bought on the account of the state, and we send our requests and gather information. These requests are sent to 112 institutions all over the country. For example, the doctor is telling you to buy such a drug named under the title Alexan, for example. You can see in which region this drug has been bought, and it was delivered to a medical institution in Kirovograd, and you can see on our map in which particular hospital this medicine was sent, was purchased for national budget money. And a patient may check whether it is possible to get this medicine free of charge. So many patients this way are empowered to understand whether the medicines they need could be get free of charge. This website is created for the person for those patients to understand whether the medicines have been bought by the state already to be distributed among oncology patients free of charge. As you usually they just take boxes, but there is a unique code on each box of medicines which can tell us this registration number on the can may tell us whether this medicine, whether this individual box of medicines have been bought for budgetary money. If the person can see a person enters the registration number of this medicine, and if you can see this red banner saying that this medicine have been bought for budgetary money, indeed, Olena Scherban is a lawyer of the Corruption Combating Center, and there are very many cases like this. They are commonplace, and we hope that the patients who buy medicines they will be careful and they will check and monitor information and the drugs which they bought. Sometimes doctors tell them to go to certain individual persons. Our web resource helps to check this information. So we ask also patients to inform us about such cases, and each patient, in order to document the case duly, a patient may submit a request to a hospital and get relevant response when a patient will experience problems like no reply or some fraudful information. We will collect such information and submit it to relevant authorities when medicines are resold by dishonest doctors. This is subject to criminal liability. That is why, depending on the values of such resales, different articles of the law may be used by but such doctors cannot be at their cannot work at their offices, and our initiative is intended to combat, to prevent such resale of medicines, and we hope that the patients will use this resource and we will provide assistance to launch monitoring over the processes of medicines sale. I would like to give the floor to the director of Cancer Institute. Thank you, Oleksandra. Of course, this I agree this initiative. It is very important one for the patients. When we came, our team came at the website of our institute, we posted all medicines which we get. Patients and their relatives can see what medicines we have in our clinics and how many of them we have, and they can submit their claims, if any, to a doctor who can offer other medicines. Therefore, I think if every top manager of every institution post in the internet the stock of medicines they have at their institution, we do not have a medicines resale problem. We have a barcode on every box of medicines. When I had not been in the director office yet, several years ago, there are target medicines for biotherapy, which shelf life is under certain conditions under 8 degrees of below zero, and we see that the barcode does not the barcodes did not coincide with the registered, and we found that this medicine was purchased in Novosibirsk by a competitive bidding procedure, and it was very surprising that it got to Kiev some way. The way of delivery of this drug was unknown. In Ukraine, the batches of medicines should not be resold. They should be available to patients free of charge. They should be affordable. This website will prevent corruption schemes in the medicine industry of Ukraine. Thank you very much. I would like to give the floor to Iryna Lytovchenko from the pills Tabletochky pills project. Thank you. Good afternoon. Our fund helps to the sick children for 4 years. We worked with the National Medical Children's Patient Center in Kiev, and this year we cover all the area of our country, and we face that volunteers and patients send us requests about the medicines for chemical therapy, and we listed those medicines and sent the request to the Ministry of Health Protection, and according to the information they are available in necessary quantities. This means that these hospitals they just keep them in storages and they hide them. Hospitals hide them in hospitals. And they resell them to the patients as this scheme we first met in winter 2014 when we bought defense medicine. It was 2,000 hryvnias for one box. We bought it as volunteers and we sent it to the hospital. After that, the parents said that this medicine is dispensed to them, but the medical nurse had this Vivant preparation, this medicine in the storage. The patients saw that. That is why we started to demand from the hospital to post on the website all the stores stores they have, so that stock taking can be maintained. This website will help patients and charity foundations so that we can buy the things which children really need, but not the medicines which doctors resell. I would like to emphasize once again, communicate such information if you face the case of deceitful practice when doctors resell medicines. This should be prevented. When oncology patients who have lethal diagnosis, they are subject to resale, and when a desperate person is willing to buy medicines for any cause, this should be prevented. So the cynicism of this situation will be demonstrated now. A puppeteer will show you this performance to show manipulations of dishonest doctors. In fact, they use volunteers, patients, and relatives of patients to earn money on people's hardships. And this way they earn fraudulently their money. Thank you. We are ready for questions.
Thank you. And now, questions. Please introduce yourself. Iryna Lytovchenko, Kiev TV channel. Sasha, tell us about this number, 112 institutions that treat cancer in Ukraine. And question to Ms. Kolesnik, and what is the percentage of medicines that are bought to these patients? So all these 112 institutions, we make requests, and these procurement, they are from the state budget, and in every region, this is there are several institutions, and separately there is a children's hospital, and there's no a lot of people who has access, but all these medicines are bought for state money. And we have about 30% of these medicines, about 70% of medicines. These are for chemotherapy, and they are bought for by the patients. As to children's oncology, I know that about half of the budget is for the children's department, and about 50%. But we try to provide only 30% provided for the adults. Do you have some other questions or comments? And Maria Gritsenko, who will finance the site? And what was the sum? What is the amount of money for to create this site? It wasn't a grant. We monitored the state procurement, and when we got all the information we needed, we decided to create a site in order to help people. And then Renaissance Fund helped us in order to so this is financed by the Renaissance Foundation. No sponsors from the drugs companies. And it was done by one of our guys. It was an initiative, and we understood that we have information, but now we can share this information through the site. It's we try to do it usable and useful. And do you have other questions? If there's no comment of questions, yes, there is a question. UCMC, I have two questions to you. First, And about the updates on the site, once in 2 months, and we will try to do it more often. And the list of medicines that is on the site, is this a full list? This is what is in stock that can be provided to the people, and we help UNICEF with the vaccines, polio vaccines. And there are different data on the number of portions of these vaccines. Different institutions provide different information. I can tell you that first we updated the site once a month, and the data changed really quickly. And the patient said that on your site there are some medicines, but in fact there's no. I think that maybe they should update the site more often, once a week maybe. And we ask for that medicines that are in stock, and figures can differ. But we provide information on the stock of these medicines provided by the different institutions. They obtain different information, and the information should be properly updated. And there's no unified system to provide the information on these medicines, to update the information daily. And the task of the state is to create such a system, to create a register of patients, and to unite these systems in order to provide this information. And there's no such a resource in our state, and we created the site, and we gather and collect information. And last year there was a situation connected with hepatitis, and we said to the ministry that there's no medicines and in the regions, and the Deputy Minister Iryna Lytovchenko, she said that there are medicines in the region, and I have shown a response from the region, and she said that according to their data, there are medicines in the regions. And so there's the exchange of information is lacking among the departments and ministries, and the ministry can find some vaccines or medicines and distribute it, but it's a problem because one region didn't use these medicines, and in some other region people need these medicines. And of course there are many opportunities, and we can use this resource in the future, and it is very useful for the Ministry of Health. And without this electronic register, we wouldn't know about real requests for these medicines and what is the demand for these medicines in the region. Phenylketonuria, when children grow, children need more protein, and no one knows what amount will be needed for the next year. So the information should be analyzed, and they go and they say to patients, "Oh, go to volunteers," and in any ministry they say so. And the ministry and the doctors, they don't like the idea of such a site because it shows disproportions and misuse of medicines. That's why we should speak about it. And also, you told us about the example, and you told us about your father, and my father-in-law undergoes chemotherapy, and we bought all medicines for our own money. So I would like to ask about the mechanisms about the second round of chemotherapy. So we go to the site and we see what the stock of the medicine is, and then we ask the hospital about these medicines. So what is the scheme, how to act? So if there's no information on the site, it means that there are no such medicines in this country. They are not bought by the state. And during the year, they can bring new medicines here, and maybe sometimes we can improve the representation of information, but you should look at the site, because you should systematically look at this site, because the information is updated. Some medicines can be brought several times a year, and it doesn't mean that if you look today, it doesn't mean that these medicines won't be here tomorrow. That's why the information, they should understand when these medicines will come. And now the Ministry of Healthcare, through Crown Agency, they wait. In a month or two, there will be some medicines bought by international organizations, and they will be provided to the medical institutions. And maybe doctors will say that they do not know when these medicines come, but we will try to update the information on the site as quickly as we can. And that's why you should follow our site. So the question can make a request. You can put your name and a hospital or a region that you need, and you create a request, and you have 5 days or about 10 days according to the law on public information, and you made a request, and then you go to the doctor. And it's rather difficult when you need it urgently, but this is what we can propose to you. People don't like to use written requests, and we developed this request. If you have a written request and a written answer, so the fact is proven that the information was not provided to you, or it was provided in a proper way, or the information was false. And if we want to do something, we should use the written request and written answer, and it provides information that can be used in order to have proper grounds and proper evidence. So, next question. We know that there is such a resource, and Iryna and her colleagues, they will provide information to parents. Parents can verify the information. And what is the mechanics? Maybe not all the people know about this resource. Maybe there's no information in the hospital. Maybe there should be some information, some campaign. And before Maidan, we addressed with this information patients' organization. They carried out a campaign, and there was a public pressure on Bogotyareva in order to provide lists of medicines in the hospitals. And in Odessa and in Odessa Oblast, in all the hospitals, there is information in the billboards and stands, and this information should be updated. And Bogotyareva made such an order, but this order was not implemented. Maidan started and Bogotyareva left. And additional resources are needed. And now this is an electronic platform. There's also a site, and this site is for those who are cancer sufferers, and we will provide information to children's hospitals, and we will prepare announcements that will be made in the hospitals, and they will be able to use the site and this information that is provided on the site. So we end our press conference until the next time. Dear colleagues, I remind that our next press briefing is at 10:30.